Do you still see the PowerPoint, doctors?
Yes, doctor.
Yeah, we
All
can
right.
see it.
We're going to start. Okay. So I just want to start with welcome to everyone here. And thank you for attending today. Our session for today is about sexual transmitted infections. We will cover many of the sexual transmitted infections in 8 different cases with 8, with different doctors. Before we have the start with the doctors, I just want to emphasize or do a kind of revision with you on the sexual transmitted infections. So as you can see, the slide is showing the differences between the discharges in different sexual transmitted infections. We have chlamydia, gonorrhea, trichomoniasis, and bacterial vaginosis. Just bear in mind that bacterial vaginosis is not a sexual transmitted infection, but I wanted to, help you in finding out what could be the differential if a patient presents with discharge. All right. In chlamydia, usually the patient presents with yellowish or cloudy white discharge in color, and the type of discharge usually mucus or mucopurulent. All right. In gonorrhea, the discharge usually yellow to green. The patient tells you greenish yellow, all right, and it's thick pus-like, okay. In trichomoniasis, yellow to green, and it's frothy and bubbly, all right. This is in terms of the discharges that you can find. In bacterial vaginosis, it's a whitish discharge, all right, but it has a very strong smell, like fish smell. All right. Okay. So this is a kind of differential between the discharge. If a patient presents with a discharge, how to reach the diagnosis based on that discharge. What is the treatment? I try to compile or put the treatment of all sexual transmitted infections in one table, just for you, to be able to memorize them easily. In chlamydia, the treatment is doxycycline, 100 milligram orally twice daily for 7 days. All right. And if the patient is pregnant, please avoid giving doxycycline. It's usually advisable to give azithromycin. All right. In gonorrhea, the treatment is usually a single dose. You give ciprofloxacin, 500 milligram. In trichomoniasis, trichomoniasis is a protozoa. In protozoal infection, usually the treatment is metronidazole. Just bear in mind this. Any protozoal infection, metronidazole is effective against the protozoal infections. All right. In syphilis, if it's primary syphilis, I mean it's a primary presentation, so you give single dose IM penicillin. All right. If it's latent, I mean it's the patient has primary syphilis before, but this is the patient presents with flaring of the infection or latent infection. So the patient should take IM penicillin weekly for 3 weeks. Okay. 1 dose weekly for 3 weeks. So in total, 3 IM injections. Okay. In HIV, you give a combination of 3 antiretroviral treatment, which is ART. Okay. In warts, usually, if they are small and not making any trouble to the patient, usually they go away in 6 months. So usually they don't treat it, or they give a botulinum cream, but make sure that this is not applicable for pregnant ladies. And then there is another two options, which are ablation or cryotherapy. All right. These are the treatments in all the known sexual transmitted infections. All right. I hope it's clear, and I hope this table will help you in, remembering the discharges and the treatment of sexual transmitted infections. All right, let's get started. Before we start, any question, doctors, or is it clear? Clear? All right, thank you. Just to bear in mind, you have to bear in mind that any sexual transmitted infection, if you suspect any sexual transmitted infection, the normal action for you as a doctor in the GB, you send the patient to the gum clinic. In the gum clinic or the sexual health clinic, they will treat the patient. All right. You don't, say the name of the medication unless the patient asks you for the name of the medication. All right. If you don't have the name of the medication on top of your mind, this is not a disaster. All right. I just wanted to increase your knowledge about the medications, but if you don't remember the name of the medication, again, it's not the end of the world. All right. You refer the patient to the gum clinic, and there they will treat him. All right. Okay, so let's start our mock for today.
Begin.
You go.
Hello, I'm Dr. Shimi. I'm one of the doctor in the GB clinic today. Are you Emma Fox?
Yes, doctor.
Hello, Emma. Could you confirm your age, please?
I'm 15 years old, doctor.
Nice to meet you, Emma. So I can see I understand you are here for some concern, Emma. So how can I help you today?
Yes, doctor. I have rash down below.
I see, I understand that. So could you tell me more about this rash, Emma?
Well, I found it last week, and it's
I see,
increasing in the number, and I don't know
I
what's
see.
that, doctor.
Okay, no worries. So did it start all of a sudden and gradually?
I just saw it last week.
I see. So is this any rash,
Sorry?
any itching? Is it any itching, Emma?
No, it's not itchy.
Any bleeding?
No,
I see. Could you describe this rash for me, Emma?
I don't know, doctor. It's just something raised on my skin. I'm not sure what
I
is
see.
this.
I see. No worries. So, Emma, was this any discharge from this rash?
No,
I see. Have you noticed that you may have any fever?
no.
Any problem with the going to loo?
What do you mean?
Any burning sensation when you are going to loo?
No, no, doctor.
Okay, that's quite reassuring. So, have you noticed that you may have any lumps or bumps around your body?
No,
Any weight loss recently?
no,
Have you been feeling unwell in the recent days?
no,
Okay, no worries. So Emma, do you have any medical condition I should be aware of?
no, doctor.
Do you take any medication?
No,
I see. Do you have any allergies?
no,
Do you have any family history, any problem with the genital area?
Mm, I don't know, doctor.
Okay, okay, no worries. So Emma, I would like to ask you some question. It might be sensitive, but it is important for our consultation. Would that be okay with you?
Okay, doctor.
So Emma, are you sexually active?
Oh, yeah.
So do you have a stable partner?
Yes, doctor.
Do you practice safe sex?
Um, what do you mean by safe, doctor?
Do you use any contraceptive? Do you use any condoms?
Um, no.
I see. So if you don't mind me to ask you, so how old is your partner, Emma?
Um, is it important to know, doctor?
Yes, it's important, Emma. We like we just questions to help to our, during our consultation, Emma.
Okay. He is 20.
I see. So how did you guys how did you meet, Emma?
How?
How did you meet, Emma?
Ah, yeah. He's my teacher in the school.
I see. Well, the phone question may sound awkward, but just to make sure everything's okay. Has he forced it by you by any way to do any sexual intercourse?
No, doctor.
Has he been ever any being abusive, either physically or emotionally?
No, doctor.
Okay. So are your parents aware of this relationship?
No, I don't want to tell
Oh,
my parents.
okay, I understand your words, Emma. So Emma, just a quick question. Do you drink?
No,
Do you smoke?
no,
Okay. So Emma, do you have any idea what could be causing this rash?
no, doctor.
Do you have any specific concern?
I just want to know what is this rash?
Of course, Emma. I will help you, but I need to examine you to be in a better position to answer all your concerns, Emma. So now I would like to examine you, Emma. Take your vitals, blood pressure, temperature, respiratory rate. In addition to that, I would like to examine your genital area and I'll provide one of the medical staff with me and maintain your privacy. Would that be okay with you?
Um, is it important, doctor?
I understand this must be sound worrying, Emma, but we need to examine the rash so we can get better understanding of the condition.
Okay, doctor.
Okay, okay, thank you, Emma. Uh, well, Emma, you told me you had been having this relationship with your teacher, and you are pressing unsafe sex. Well, Emma, after examining you, I believe you have a condition called genital warts. Have you heard
Uh,
about it before, Emma?
no, what is that, doctor?
Okay, well, don't
Remaining.
worry. It's not serious condition. However, it's a sexual transmitted infection that caused by transmission of the infection from a person having this infection, which I believe this condition is your teacher. So it's a manageable condition. Would you like me to tell you our management plan?
Yes, please, doctor.
Well, Emma, I'm sorry to inform you, but I have to inform the safeguarding regarding this relationship as it's unethical for this the relationship to go any further. As that you
He didn't force me, doctor, and I
I
love him.
under I
Why
un,
you want this?
I understand your words, Emma, but any patient, any person in a position of trust should not have any sexual relationship with any minor. You understand me, Emma?
But he didn't force me, doctor.
I understand, Emma, but if he did this with you, it is more liable to do with anyone else, and we don't want that to happen. So, how does that sound, Emma?
Are you going to tell my parents, doctor?
Well, unfortunately, yes, Emma, we have to inform your parents' involvement in this decision.
I don't want them to be involved, doctor.
I understand yours, Emma, but I'm sure that your parents will be supportive and will help you through this difficult time. Don't you think that?
I don't know.
I understand it must be very stressful, Emma, but we are here to help you, and we want to make sure that everything is okay with you. Would you like me to continue our management plan, Emma?
Okay, doctor.
Okay, regarding this lesion, Emma, I will refer you to the gum clinic to do further screening tests for
Move on to the next
infection.
station.
Time is up. All right. Thank you, Dr. Ahmed. Yeah, so how do you feel?
I feel a little okay.
All right. Um, so you did okay. All right. You've mentioned safeguarding team, and you started treatment of um the sexual transmitted infection, which is good. There are some few things that I'm going to talk about in terms of your interpersonal skills with this minor in the management part. Before the management part, your interpersonal skills were very, very nice and good. Okay. But in
Okay,
in the management part, you need to be more friendly with her. She's 15, she's minor, maybe she doesn't understand, or not understand, she might be overwhelmed by all of the information that you give to her, and you scared her by telling her, unfortunately, we will need to inform the safeguarding team. So I think you could have done it better than that, and we are going to talk
uh,
about it too.
I understand that, doctor, but when the 2 minutes started, I just wanted to get back to get to the point of safeguarding. It is the
Yeah,
core of this station.
Begin.
So I feel like racing in the keys. I wanted to reach to that part. I knew I was in a kind of hurry, but I didn't have
yeah,
any other option.
it's understandable. It's understandable. All right. So how to overcome this, Dr. Ahmed, if you want to start the management a bit earlier?
Um, well, I tried to be as brief as possible in the history, but the textual part it took a lot of time, and we had to explain it more.
Okay.
So I think that's the problem.
And do you think asking about smoking and alcohol here would be um, very, very, very or extremely
No,
important?
no, not
Yeah.
at all. No, no.
All right. So you don't need to ask smoking and alcohol. Also, you don't need to ask about family history of of genital problems. Also, you don't need to ask about allergies. All right. So 4
Okay,
questions could help you to start the management a bit earlier, right?
all right.
Okay. So always think about the time management by cutting down or cutting off your questions. Uh, okay. So if I would say about if what is the type of this case? It's a history-based case. The task is um, talking to the patient, take history, address the concerns, and discuss the management plan with the patient. You touched on all of these, which is really good. In terms of your interpersonal skills, so in terms of body language, I cannot comment on the body language, but I can comment on your tone of voice, which is matching the situation. Um, in the management, you could have done it better, and we are going to talk about how to improve or how to say it in a better way. In terms of your interpersonal skills, you build a rapport with the patient, you acknowledged everything with the patient, you asked her about concerns and her ideas about the problem. You were a bit sympathetic, and we are going to talk about how to be more sympathetic with the patient and how to be more friendly. Um, in data gathering, you didn't miss important points, but you asked 4 irrelevant questions. We've talked about that. What's the management points, or what are the management points? If I were you, uh, uh, um, if I have time, I would start by the treatment of the water and then the safeguarding. But as you were running out of time, it's a wise decision to start by the safeguarding point. Okay?
Okay.
So, how to tell her that we will need to inform the safeguarding team? You tell her, well, Emma, okay, so the presentation that you have, or the rash that you have from the examination, I can say that this is a sexual transmitted infection, or a viral infection that transmitted from your teacher to you through the sexual interaction, okay, or the sexual relationship. All right. What's concerning me is that your teacher shouldn't have a relationship with you because he is a position of trust. Any teacher shouldn't have any relationship with their students. And this is against the law in the UK. All right? And I'm concerned about you. He might do something wrong with you, or with any other students. We need to make sure that you are safe. So we will need to inform the children safeguarding team. Got me, Emma? So you try to tell her, or you signpost that this shouldn't be you know, a right relationship. Then you tell her that the action, or the right action, is informing the safeguarding team. What you did, Dr. Ahmed, is you told her first, we will inform the safeguarding team first, and then you explained. This will take too much time from you if you don't explain from the start. The student will tell you, doctor, no, I didn't do that. I didn't, he didn't do anything wrong with me. He was nice with me, and these things. All right? By explaining firstly that this is against the law, and this shouldn't be happening under the law of the UK. All right, and your teacher did
2 minutes remaining.
very wrong with you. He might do that with these other students. All right, and you are vulnerable, so we will have to inform the children's safeguarding team, Emma. Okay, Emma? All right. Are you going to tell my parents? Tell her, well, okay, I highly encourage you. I highly encourage you. She understands, right, Dr. Ahmed?
Right. Yes. Yes.
Yeah, she
She
has
should try first.
yeah, she has mental capacity, right?
Yes.
Yeah,
The option to tell them first.
yeah, she has mental capacity. Should you tell her, well, I highly encourage you to tell your parents. They will be very supportive to you. All right? If you don't want, it's okay, but we will leave it to the safeguarding team. They will talk with you, and they will do the best option for you. Okay? If the child is more than 13, all right, and he has mental capacity, informing the parents is a kind of encouragement. You encourage her to tell her parents. If she doesn't want, it's fine. The safeguarding team will take the action, the right action. But if the child is less than 13, the parents should be informed, especially if
I
the
know, doctor, but in the case, I saw that she didn't have this capacity. She asked some questions that was not that have the ability to to make a decision regarding his sexual life. That was my problem in the case. She asked
So
about the
what
safe
did
sex. She asked about she didn't know what is safe sex. So that was I understood that it may she is not having the full information regarding the cause.
this doesn't mean that she doesn't have mental capacity. If she doesn't know, this doesn't mean that she doesn't have mental capacity. Maybe she doesn't have the sexual orientation, or she doesn't know more about sex and how to protect herself and these things. This doesn't mean that maybe she doesn't have knowledge, not mental capacity.
Okay,
All right?
okay, it ends. Okay,
Got me?
yes,
Uh, yeah. Uh, so you inform the children safeguarding team, and the children safeguarding team might involve the police, and they might inform the parents as well. All right. But if she tells you, doctor, are you going to tell my parents? I don't want, you encourage her. All right. Your duty is to encourage her to tell her parents. All right. And the children safeguarding team will talk with her, and they will try to help her by telling her parents. Okay. What is the treatment of the warts itself in her condition?
surgery or the
Yeah,
cream.
if it's mild, wait and see for 6 months. All right. But what are you going to do is sending her to gum clinic for screening. All right, for all sexual transmitted infection, and there they will treat the condition either by wait and see or by cryo or ablation. All right.
Okay,
Okay, so this is in terms of the of this case. Okay. Got how to deal with this situation, Dr. Ahmed?
yes, Dr. Saki.
All right, thank you, Dr. Ahmed. Let's do the next case with Dr. Ala. Ready, Dr. Ala?
الو اي دكتور معاكي.
Hello, are
الو
you
ازيك؟
ready?
fine. okay.
Ready?
yes.
Okay. So yeah, read your question, please.
it's okay.
Have you read it?
yes.
All right. So just give me a second to start the timer.
Begin.
Start.
Good morning, my name is Dr. Ala Abjawad, my GMC number 1234. Can I proceed?
Yes.
Okay. Good morning, my name is Dr. Ala, one of the FY2 in GP surgery today. How can I call you, please?
I'm Jonathan Rosemary, so you can call me Jonathan.
Nice to meet you, Mr. Jonathan. Can you confirm your age, please?
I'm 24.
24. Nice to meet you, and have a seat, please. How can I help you today?
Well, doctor, I noticed that I have ulcer on my penis.
Mm-hmm.
Yeah.
I am so sorry for that. Could you tell me more about that?
What do you want to know, doctor?
When did it start?
It started, I found it maybe 1 week ago.
1 week ago.
Yeah.
Okay. It starts suddenly or gradually?
I found it. I found it.
Mm-hmm. It is progressive or regressive, improving or worsening.
Well, it's increasing in size. Yeah.
Mm-hmm. Increasing in size. I am so sorry for it. Could you describe it?
It's a kind of ulcer, doctor. It's a rose part of my skin.
Mm-hmm. Is it painful?
No, it's not painful.
Is there any discharge from it?
Not really.
Mm-hmm. Is there any rash?
No,
Mm. Do you experience any increase in your temperature?
no,
Mhm. Is there any eye pain?
no,
Is there any joint pain?
no,
Do you notice any lump or bump in your body?
not really.
Mhm. Do you experience any burning sensation in your urine?
No,
No, very nice. Just an ulcer
yeah,
Mhm. In your penis?
yes,
I am so sorry for that. So is it bleeding?
no.
No. Can you give me size?
Like 3 centimeters.
3 centimeter. Is there any ulcers you notice in your mouth?
No,
Very nice. Can I ask you some questions about your sexual relationship?
okay.
Mm-hmm. Are you in active relationship?
Yes, I'm sexually active.
Are you unstable?
Not really. I do have some casual partners.
Who is the last one?
Uh, like 2 weeks ago, no, I'm gay, so I
Mm-hmm.
do have sex with males. Yeah,
Mm.
I do
Do you
have
experience sex with females also, or just with male?
no males only.
Do you practice it safely using condoms?
No,
No. Do you take a screening for STI recently?
no. What is STI, doctor?
Sexual transmitted infections.
No, I didn't have any screening.
Very nice. Can I ask you some more questions?
Okay,
Do you have any disease?
no.
Any medication?
No, I'm not on any medications.
Okay. Do you have any allergy?
No,
Very nice. Going to your lifestyle, do you smoke?
no, I don't smoke.
Do you drink?
Yes, I drink alcohol occasionally.
Do you use any recreational drugs?
No.
Okay. Sure. Is there anyone around you to support you?
Um, well, no, I live alone.
Okay. What do you do for living?
I'm a taxi driver.
Taxi driver. Is it affecting your mood or life?
No,
Very nice. Do you have any idea what you have?
no, doctor.
Do you have any concern?
No, doctor.
Mm-hmm. Can I examine you, please?
Uh, well, yeah. What do you want to examine?
I will examine your tummy and your private area and check your vitals and order urine analysis. Is it okay for you?
Okay.
Thank you for letting me examine you. Based on your history and examination, we need to order some tests like routine bloods and urine culture and take a swab from this ulcer for culture. Is it okay for you?
Okay, doctor.
And we need to make serology for some infectious disease like syphilis and HIV. Is it okay?
Um, all right. No worries. Are you going to do that in here in the GP, doctor?
No, I will refer you to Gum
Two
Clinic.
minutes remaining.
Is it
O-
okay?
Okay.
Mhm. Based on your history and examination, I suspect you have one of sexual transmitted infection. Maybe it is syphilis, but to confirm it, we need to do some screening for all types. Is okay?
All right. Is it serious, doctor? What is this infection?
I am so sorry you feel that, but it is important to exclude all causes which can cause infection to take the suitable treatment for it. Is it okay?
Yes, but is it serious?
Yes, it is important to find and diagnose it. Take the suitable treatment to prevent any progression or complication.
All right, doctor.
Mhm.
How
Uh,
are you going to treat me?
Mhm. Firstly, as I said, I will refer you to a gum clinic where a specialist will deal with you. Secondly, I will offer for you antibiotic like penicillin if you're not allergic to it, as you said.
Mhm.
And we need to contact your partners through partner notification to trace them. Is it okay for you?
No, it's okay, no worries.
And also, I need you to avoid sex till screening is done. And after screening, you need to repeat the screening when you change partner and use condoms with your partner. Is it okay?
Okay, doctor.
And please, if you develop any fever or
Move on to the next station.
All right, time's up. Thank you, Dr. Ala. Right, how do you feel?
الحمد لله بس مش متأكدة من الدياجنوزس قوي.
Okay, it's syphilis.
Yeah, nice.
Syphilis. All right. When is your exam, my dear?
لا لسه ما اتحجزتش.
Okay, good. So you still have you are still in your start, right?
Yes, yes.
Okay, that's good. That's good. That's a really good start. Did you practice before?
Yes, twice.
Only two stations before.
Yes, yes.
Good. That's good. All right. Good. That's good. All right. All right. So, okay. So we are going to comment on your performance.
Mm-hmm.
Firstly, what is the type of this case? The type of the case is history-based case. The patient presents with a specific presentation. You ask some questions, you take the medical history, and then you reach the diagnosis. All right. What is your task? The task is talking to the patient and address his concerns. So the patient has some concerns. You have to talk with him and address these concerns. To be honest, you didn't address one of the concerns. I told you, is it serious, doctor?
Mm-hmm.
You didn't answer a clear answer to me. All right? I asked the question.
Begin.
Doctor, is it serious? You tell me either it's serious or not. Or you tell me, well, okay, it is treatable. Okay. For now, it's not serious. It could be serious if it's not treated.
أنا فاكرة أنا جاوبت على قلت yes it is serious but if you take if we reach a diagnose and take the suitable medication we can prevent a complication.
All right. It's the clear answer is it serious? Is it serious for now? Is he dying?
لا تمام.
All right. So it is treatable. Let me reassure you that it is treatable, but it could be serious. Don't scare the patient. All right?
تمام.
One of your mindset that you should set your mind on is don't scare the patient. Okay? So you tell him, well, okay, it's treatable, but it could be serious if we don't treat it. All right? Okay. In terms of your interpersonal skills, well, I do have many comments on your interpersonal skills, and this is normal, totally normal for someone who's starting.
Mm-hmm.
Okay. So don't be, hard on yourself or don't feel any down. Okay. As I told you, it is really good start for you. Okay.
Okay, doctor.
So you always say very nice for everything. I would advise to change it. Okay. You can
Mm-hmm.
say, All right. I see. Okay. If it's reassuring, you tell her, okay, it's quite reassuring. Okay? Instead of very nice.
تمام.
Okay, Dr. Ala?
Okay, doctor.
So take very nice out from the conversation, please. All
Okay.
right? You
Okay.
can say very nice if something nice, all right?
Mm-hmm.
Okay? So
Mm-hmm.
this is in terms of the first point that I wanted to comment on interperson skill. What else? You tried to ask all of the points of history taking, and this is not right. Okay?
Mm-hmm.
Is it important to find the patient has female or male partners? Will it change the situation or the treatment?
Will change the treatment? I think no.
No,
Mm.
right? So no need to ask. If
Mm-hmm.
he's gay and he has unprotected sex, it's fine. All right? So you don't need to find out more. The gum clinic will take this from you. Okay? They will ask everything. All right? As a GP, you just need to find out what's going on to reach the right diagnosis, and that's it. Okay? All right. Do you need to ask about family history? You didn't ask about family history, right? I'm not sure. I can't remember. You asked about family history?
No.
No. All right. You asked also about mood and who supports you at home. These are not relevant to the case.
Okay.
Got me, Dr. Ella.
Okay.
It's not relevant. A patient who he presents with ulcer. He's 24 years old. He's totally independent, doing everything by himself. It's not a disabling disease. So you don't really need to ask about who supports you at home.
Okay, doctor.
Got me?
Yes.
All right. And mood as well, not very important. Yeah. When you examine the patient, you have to provide a chaperone with you, especially it is an intimate examination. All right? So I'll provide a chaperone with me, and I will ensure your privacy. Okay?
Okay.
All right. So these are the points that I wanted to emphasize on in your interpersonal skills and in your data gathering. Okay?
Thank you, doctor.
In management, thank you, darling. In the management, well, you tell him, okay, you might have caught one of the sexual transmitted infection, which is something called syphilis, which is a bacterial infection. This is how to be clear and to the point to the patient. All right? You might have caught one of the sexual transmitted infection called syphilis, which is a bacterial infection. For that,
All right.
we will need to refer you to the gum clinic. They will do this and this and this. All right? In your management, you were a bit, hesitant. You told me we will refer you to the gum clinic, and I will do this and this and this. All right? So you refer the patient to gum clinic, and they will do everything to the patient in terms of the screening.
تمام.
And they will inform the partners, and they will treat him. Okay?
Okay.
All right. So it's just about, organization of your thoughts in the management. But you've mentioned mostly all of the points, which is referring to gum clinic, screening, treating, and informing the partners, no sex and protected sex with partners. Okay?
Okay, doctor. Thank you.
Right. Thank you, Dr. Ala. Well done. Let's do the next case. Dr. Ahmed, ready?
Yes.
All right. Let's do the next one.
Begin.
Hello, I'm Dr. Shimi. I'm one F2 doctor in the GPSA today. Are you Mr. Harvey Walker?
Yes, doctor.
Hello, Mr. Walker. Can I call you Kaya? Can I call you Harvey?
Yes, Harvey is fine.
Okay, Harvey. So could you confirm your age, please?
Well, I'm 30 years old.
Okay, nice to meet you, Harvey. So I understand that you are here for an appointment today, and you have been in the surgery 2 weeks ago. So how are you doing now?
I'm doing okay, doctor. I came 2 weeks ago with some flu-like symptoms, like common cold, and then they reassured me, and I'm here just, because I've noticed something new.
Oh, and I'm very sorry to hear that. So could you tell me more about it?
I found a lump in my groin, doctor.
Oh, I'm very sorry to hear that. It must be very stressful. So when did you notice it, Harvey?
1 week ago.
I see. I think increasing the size.
No,
I see. Uh, have you tried anything for it?
nothing, doctor. It's just a lump. I don't know how to deal with it.
Okay, could you describe it for me?
I don't know. Just firm lump in my groin.
I see. How about the skin over it?
It's okay.
I see. If you don't mind me asking, is it soft or it is hard?
It's firm.
I see. Is this any lump anywhere of your body?
No, I didn't notice anything in my body.
I see. Have you just maybe in discharge?
Discharge from the lump? No,
Now, is discharge from your genital area, Harvey?
no,
Any bleeding from the lump?
no,
I see. Have you just let me you have been feverish?
no.
I see. So you told me that you had a flu symptoms about 2 weeks ago. So did it go in its own, Harvey?
Yes, they went. Yeah.
Okay, okay, this is very good to hear. So Harvey, just a quick question: Have you recently lost any weight?
No,
I see. Have you said maybe feeling unwell in the past few days?
no,
Any loss of appetite?
no,
Okay, okay, no worries. So Harvey, do you have any medical condition you should be aware of?
no,
I see. Do you take any medication, including over the counter?
no,
Okay. So I understand this must be alarming, but it's just a routine question. Is there any family history of any cancer?
no.
Okay. So I'd like to ask you some question regarding your sexual life. Would that be okay with you?
Okay.
Okay. So are you sexually active?
Yes,
You have a stable partner.
yes, I have my wife.
So do you have any casual partner, Harvey?
Um, well, it happened only once, 4 weeks ago, with one of the male prostitutes in Thailand.
I see. Did you use condoms during this time?
No, doctor.
Okay. So Harvey, do you smoke?
No,
Do you drink alcohol?
no.
I see. So what do you do for a living, Harvey?
Um, a taxi driver.
Okay, okay, nice. So Harvey, do you have any idea what can be causing this swelling?
No,
And do you have any specific concern?
no, doctor.
Okay, okay, no worries. Harvey, now I would like to examine you, take your vitals, blood pressure, temperature, heart rate, and respiratory rate. In addition to that, I would like to examine your genital area, examine the lump. In addition to that, I will do an investigation for the lymph node of your body, and I will provide the chaperone with me, and I will maintain your privacy. Would that be okay with you?
Okay, doctor.
Okay, thank you for letting me examine me. Thank you, Harvey. Examination. Oh, ماشي. Okay. Thank you for letting me examine you, Harvey. So, Harvey, you told me you had an unprotected sexual intercourse with a male prostitute about 4 months ago. After that, you experienced some flu symptoms, followed by a lump in your body.
Mm-hmm.
Uh, well, Harvey, there are few causes of developing this lump, but the one I'm concerned about is developing a sexual infection, which is HIV, Harvey. Have you heard about it before?
Yes, doctor, I know HIV. Oh my God.
I understand it must be very shocking and useful for you, Harvey.
2
But
minutes
let me tell
remain.
you, there's nothing confirmed yet. We just want to be on the safe side to exclude anything serious. Are you following me, Harvey?
So what are you going to do now, doctor?
Okay, now Harvey, I will refer you to the gun clinic. They will do further investigations, uh, some blood tests, and in addition to that, screening uh, for the all sexual transmitted infection. Do you think you can do that, Harvey?
Yes.
Okay, Harvey, that's very good to hear. So, regarding what you can do for yourself in the meanwhile, please, Harvey, avoid having any sexual intercourse with your wife. Do you think you can do that?
Actually, doctor, I had unprotected sex with my wife. So should I bring her?
Harvey, for the meanwhile, there's nothing confirmed yet, but it will be better to inform her, and you can notify her if that possible to get screened. Do you think you can do that?
Yes, I can, doctor.
Okay, that's very good to hear. And as I told you, Harvey, in the meanwhile, please avoid having any sexual intercourse until the news is confirmed.
Okay, doctor. Is there any treatment for HIV, doctor?
Harvey, unfortunately, it's a lifelong condition. But if it is confirmed, we'll refer you to an HIV specialist who will review you and prescribe some antiviral medications that you have to take for a full life. Are you aware of that, Harvey?
Doctor, so I'm not going to live a normal life, doctor?
Let me assure you, if you take these drugs as prescribed, you will have a normal life, and this will reduce the level of
Move on to the next station.
Thank you. Okay, thank you, Dr. Ahmed. All right. How do you feel?
Well, I feel in the history taking, I was a bit confused. I went up and down, but it was some kind vague. So I was
Mm-hmm.
not sure if it's HIV. I'm not sure where the swelling was.
Mm-hmm.
So yes, I think that's a problem in
But
the
you,
case. But
you went in an organized way. I didn't feel that you were uh, a bit disorganized, except in when you explored the lump. You told me
yes, that
yes, you told me any discharge. Then I told you from where discharge from the lump or discharge from
yes,
then
I
any
thought
pain. Yeah,
I I thought it, the lump was in the lower part of the genital area, so that was the part of confusion. I thought it was his genital area, so
yeah.
this was the part I was confused about.
Yeah, just be clear with the patient. What do you mean discharge from where and pain from where and these things, okay?
Okay,
Yeah. So the type of the case is it's a
history taking.
history based, to be honest. The patient presents with a symptom and you are asking to reach the diagnosis, all right, even if he has few
Begin.
symptoms before, but he came in with a new symptom, all right. What is your task? Talk to the patient, take a focused history, and assess the patient and discuss management. Alcohol and again, alcohol and smoking here is not that important. You can skip them, all right? Interpersonal skills, no comment, to be honest. You build a rapport, you acknowledged, you asked ice, you were sympathetic. The only thing is, you scared me by telling me that I'm going to take the medication for life and it's a lifelong condition. You just tell me it's treatable. With people now can live a normal life with treatment. The treatment minimum, you know, the minimum period of treatment is 6 months. It could be more than 6 months, but the minimum period is 6 months. If the viral load is becoming low, then you can stop treatment. So this is how to answer the question. In data gathering, as I mentioned, you were a little bit disorganized, but not to the point that you missed everything. No, it was okay. What else? Let me see, just smoking and alcohol as well, as I mentioned. There's something that you missed, which was very, very important.
Did you have unprotected sex with your wife?
Yes.
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 Well, I was going to answer it, but I got confused. Not confused. I was excited that I reached the diagnosis, so I
Mm.
just close the textual part and move to the other points. So that's a problem here.
No worries. Okay. So this is very important. This is very important. You have to find people at risk. Okay.
Yes.
In management, you refer the patient to, you told him that it could be HIV. We didn't confirm anything yet. And you referred me to the gum clinic. There they will screen, they will start treatment, and they will, you can, they will inform your partners, and you encourage him to tell his partner. He was happy to inform his partner. There was no problem in that. Did you tell me about no sex and then protected sex afterwards?
Yes, I told him please avoid having any intercourse for the meanwhile until it's
Yeah,
everything
yeah,
confirmed.
yeah, yeah, yeah. Okay, all right.
Okay.
Okay, these.
So doctor, I just have a question here regarding his work. If he's a medical professional, should he stop working
Now or
yes
after? Or after confirming?
before confirming?
Stop working? No. Medical, what do you mean by medical? What is his work exactly?
Like a doctor, a doctor. He's a doctor,
If he's a doctor, then
nurse.
he should tell the occupational, the OcuHealth about the problem, and then they will guide him what to do. They might
Okay,
tell him to change the type of the job that he do. Maybe he just sit on the computer and just report patients and these things. They can change the work based on the situation, all right? But no stopping of the work. He just taken advice from OcuHealth, all right?
okay, okay.
All right. Yes. Okay. Thank you, Dr. Ahmed.
Thank
Let's do
you.
the next case, doctors. Dr. Ala, ready?
Yes, doctor.
The people who joined us later, no one has written his name in the chat box except Dr. Ala and Dr. Ahmed, so I'm just taking cycles between them. All right? If anyone wants to write his name or her name, please write in the chat box. Yes, let's do the next case, doctor. Ella. Read your question, please.
Okay, doctor, I'm ready.
Sure.
Hmm?
Are you sure?
Yeah.
Okay, just give me a second to just write down or send the after this station always. Okay. Start the timer. Few seconds, then we will start.
Begin.
Good morning. My name is Dr. PLAB Jawad. My GMC number 1234. Can I proceed?
Yeah.
Okay. Good morning. My name is Dr. PLAB Jawad. My one of the FY2 income clinic. Can you confirm your name, please?
Yes, I am John Walker.
How would you like to call you?
John is fine, doctor.
Okay, Mr. John. Can you confirm your age, please?
It's 30, doctor.
Nice to meet you. Have a seat, please. I can see from your notes you are here for test result. Am I right?
Yes.
Is there anyone discuss it with you before?
Well, they told me that I might have sexual transmitted infection, but
Mm-hmm.
they were not sure exactly what it was. What is it?
Very nice. I will very well. I will ask you a couple of questions to be in a right position. I will tell you the result. Is it okay for you?
Okay, doctor.
Could you tell me what brought you the first time?
I have swelling in my groin, in the left part of my groin.
Mm-hmm. Is it increasing or decreasing now?
It's the same.
It's the same, no change.
No,
Mm-hmm. Is there any discharge from it?
no,
No. Okay. Do you try any treatment?
no, I didn't.
Mm-hmm. Is there any investigation done other than what we are going to discuss it today?
No, they just did some screening for the sexual transmitted infections and some bloods as well.
Mm-hmm. How are you feeling now?
I'm feeling okay, doctor.
Mm-hmm. Is there any new complaint?
No,
Okay. Can I ask you some question about the swelling?
okay.
Where is it, please?
It's in the left groin.
Is there any swelling in your body?
No, just in the groin.
Mm-hmm. You told me it is the same size and no change in it. Am I right?
Yes, doctor.
Is it itchy?
No,
Is there any pain in it?
no,
Mm-hmm. Do you experience through the last week any increase in temperature?
no,
Okay. Do you experience any oral thrush or repeated chest infection?
no.
Okay. Um, could I ask you some question in your sexual history?
Okay.
Are you active sexually?
Yes, doctor.
With male or female?
With my wife.
Is there any casual relationship recently?
Well, I had one casual relationship with one of the prostitutes in Thailand. I were in Thailand in 4 weeks before.
Mm-hmm. Do you practice it safely using condom or unsafe?
Unsafe.
Mm-hmm. Okay. Have you done sexual transmitted infection screening other than today?
No, this is the first time.
Okay. Do you have any disease?
No,
Do you take any medication?
no,
Any allergy to any medicine?
no, doctor.
Mm-hmm. Okay. Do you take any recreational drugs?
No,
Do you smoke?
no,
During the last period of your life, do you experience any effect on your mood?
no, doctor.
Is anyone around you support you?
Yes, my wife.
Okay. Based on your result and the history you have taken, your lab is normal, except you have HIV. In 2 occasions is positive. HIV. Are you following me?
Oh my God, doctor.
Mm,
Are you sure?
I really sorry you feel that way, but I am sure we have double check it. Is it okay?
Doctor, can you do it again, please?
Sure, I can do it again, but let me assure you that we have double check it before we release the result to you. I really sorry for your feelings.
Oh God.
Mm.
So,
Do you know what is the meaning of HIV?
yes, doctor, I know HIV. Oh my God. So,
Mm.
am I going to live a normal life, doctor?
Let me reassure you that with treatment and regular follow-ups, you can live
2
normally.
minutes remaining.
You can live normally and practice your life normally. Do you have any other concern?
Yes, doctor. So should I tell my wife now, or what should I do?
Actually, you need to tell your wife now to do the test for her also.
But I don't want. It's just it was. I'm always faithful with her. It's only one time.
I
No,
appreciate
I don't want to tell her.
your concern and worry, but it is her health, and her health is our priority. So it is better to inform her and discuss together. Is it okay?
I'm not sure, doctor. Can you help me in that?
Yes, actually, I can. We can tell the notification partner notification center, and anonymously they will tell her. Is it okay?
I don't know. So, I'm not sure, doctor. Should I inform my employer then about
Uh,
it?
if the contract between you and the employer is important to tell any infectious disease, it is important to tell him. Is it okay?
Hey, doctor.
Okay. Can we discuss the treatment?
Okay.
Okay. Firstly, we need to start retroviral medication and trace any other contact with you. Is it okay with you?
Okay, doctor.
Mm-hmm. Please avoid sex.
Move on to the next station.
Okay.
My time's up. Thank you, Dr. Ala. All right. How do you feel?
الحمد لله أحسن شوية من الأول.
Mm-hmm.
حسيت أتجنب very nice.
Good. That's a really good, intention. So you just need to, change very nice to IC.
Mhm.
Okay, IC.
I
Okay,
see. Okay.
IC. All right. Then after that, with the practice, you will get used to more phrases. But
Mhm.
just get rid of this first, and then we can do the other things. All right.
Okay.
the same problem in asking about support and mood. In the case here, they are not relevant, or the way you asked them was not relevant. Okay, the patient is 30 years old. He just has lump in his groin. He's not disabled, so no need to ask about support at home, please. The support at home is usually with the patients who are elderly or having disabled have disability. All right.
انا كنت متوقعه اللي هو السبورت ده مثلا لو حد عنده مثلا infectious disease، وبالذات لو sexually حد هيدعمه، حتى مش لازم جسديا قد ما هو emotionally.
Well, he doesn't know
Begin.
that he has sexual transmitted he doesn't know that it is confirmed. All right.
Yeah, okay.
So the way you asked was not that relevant. Okay.
Okay.
What is the type of this question? The type of this question is explaining test results. And a bit of breaking bad news. The patient doesn't know that it could be HIV. He was thinking that he might have one of the sexual transmitted infections. Okay? So it's explaining test results with sensitivity. All right? You should be sensitive in explaining the test results. To be honest, you didn't do that, Dr. Ala. Your tone of voice was monotonous. You didn't play with your tone of voice while you are telling him it is HIV. Okay? So you tell him in a sensitive way. You tell him, well, okay, Mr. X, all of the investigations are normal, thankfully, but they were positive for HIV.
Right.
And give a pause. Okay? You were monotonous during giving me the results. All right?
Okay.
Okay. So the type and task, we have talked about it. The body language, I can comment on your tone of voice. And I told you your tone of voice was not matching the situation. You have to adjust your tone of voice to the situation. It's a bit of breaking bad news. All right? Your tone of voice should be lower than this, and you should give a pause to the patient. In interpersonal skills, again, it's about the way of dealing with the situation. All right, it's a bit of breaking bad news. In data gathering, no need to ask about the lump. The patient is already diagnosed. HIV, no need to ask about the lump. All what you need to ask is about the symptoms of HIV, the other symptoms of HIV, like recurrent infections or diarrhea or common cold or malaise or fever and these things. Okay? But asking about the swelling, not appropriate. Smoking and alcohol as well is not that important. Mood and support, as I mentioned, not important at all. Then you tell him the diagnosis. We have talked about how to deliver the diagnosis to the patient in a sensitive way. I asked some questions. You answered most of them, which was good. What is the treatment? What is the treatment? What are you going to do?
Retroviral medication?
Yes, you check the viral load of the patient and then you give retroviral medication, 3 of the retroviral medications for at least 6 months. Avoid sex, or if he wants to have sex, you know, use protected sex. Tell the partner, he refuses, then you tell him, well, okay, I can see that you don't want to tell the partner. Can you tell me why is that? Then he tells you, doctor, I always faithful with her. It was only one time. You tell him, okay, I can see it is a really difficult situation, but she deserves to know it's a serious infection, and if she didn't or she doesn't take the treatment for it, it will be life-threatening for her. Are you getting me, Mr. X? Then if he's still refusing till the end, it is your duty to inform his partner.
Okay, doctor.
All right?
All right, doctor. Thank
The
you.
HIV. Okay?
Okay, doctor. Thank you.
Thank you, Dr. Ala. So what do you want to do, Dr. Ala, in your performance? Just to focus on getting rid of very nice and how to ask the relevant questions and how to play with your tone of voice. These three main things, focus on them now, and then we can take it from there.
Okay, thank you, doctor, very much.
Okay, Dr. Ala. All right. People are raising their hands. Just give me a second, doctors, to anyone who is new here. These are my links. Okay, you can join us. Dr. Ahmed is raising his hand. We are going to take 5 minutes break, okay? And then we can do the other 4 cases. But let me see the Dr. Ahmed, you can switch your mic.
Doctor, I wanted to ask about the last case. Isn't it breaking bad news? We should start. Unfortunately, I don't have good news. The news is, and move on from here.
Yes, you can. Yes, as I told, it is a breaking bad news. It is a bit of breaking bad news. The patient has,
Yes.
yes, the patient has an idea about that. He might have a sexual transmitted infection, but he doesn't know what is the sexual transmitted infection itself. So yes, all right.
And regarding our management, should we say refer you to the HIV specialist to be seen urgently, or we treat him in
Send
the
him,
CB clinic?
but the gum clinic will treat the patient and start him on antiretroviral treatment, and then check the viral load every now and then. All right.
Okay, doctor.
Both of
Okay,
them are right.
okay, doctor. Thank you.
Thank you. What if the patient was reluctant and refuses going to the gum clinic? You still have the patient, if he doesn't know to go if he doesn't want to go to the gum clinic, then you follow the refusal structure by asking him why. You acknowledge that he doesn't want, and you ask him why. What is the meaning of acknowledge? You tell him, I can see that you don't want to go to the gum clinic. May I ask you why? What is the reason? And based on the reason, you try to address that reason. If he's still reluctant, then you can do the investigations in the clinic, but you tell the patient that it will take time. In gum clinic, it's a quick clinic. They will do the investigations quickly, and they treat the patient quickly. All right. Should we say unfortunately or I'm afraid? Yes, you can. I can practice, doctor, if you don't mind. Yes. Who is Zoom user? Who is that? Zoom user?
Yes, doctor, I'm Radwa.
Okay, Dr. Radwa, no worries, you can after the break. Can I do a station, Dr. Mustafa? Yes, you can. Doctor, in confirmed HIV and no question. No question. Doctor, I'm not sure what's your question. Do we need to mention that if he's still refusing to inform his wife that she might suit you and so you and so on. Yes, she can. Yes, if she get to know that she has HIV and her partner knows that, she can bring him to the court. All right? All right. So yes, he should tell his partner, and your duty is to tell his partner if he's refusing. I may try to swell as well if possible, but I don't know what to ask for her. It's fine. Take the opportunity. Please, doctors, write down your change your profile name with your actual name, because I don't know who I'm talking with. All right? Okay, Dr. Peter. Yes, it's fine. I don't mind if you are starter or in the middle or at the end of your preparation, as long as you want, it's fine. Dr. Khalil, you raised your hand. Any question?
Thank you. My question is about in case when we want to share the results, do we need to go again to all this factor of history taking, or just we need to focus on the results and some additional guidance to the patient? Thank you.
Yes, if it's a test result case, you don't need to take too much history. You focus on the abnormal findings first, only. So what is the abnormal finding here? HIV. You focus on symptoms and causes of HIV. Symptoms and causes of the abnormal finding. And this is my structure in my course. My structure in my course. Symptoms and causes of the abnormal findings. What are the symptoms of HIV? He has lump. You ask about other symptoms like fever, feeling unwell, night sweats, diarrhea, recurrent infections. What are the causes of HIV? The most common cause here is sexual. You can also ask about the blood transfusion, if he had blood transfusion before, or drug abuse. All right? These are the questions that you can fulfill in any test results. And here in the case of HIV test results, these are the questions that you can fulfill. Please bear in mind that if the patient had unprotected sex with a casual partner, you have to ask about people at risk. Did he have any sexual intercourse, unprotected sexual intercourse with his stable partner or with his wife? Please. Okay? Or any unprotected sexual intercourse afterwards, just to find out the people at risk and to inform them, even anonymously. In any sexual transmitted infection, I'm not talking about HIV only. Okay, doctors? All right, is it clear?
Yes.
All right. Okay, so we have 2 more minutes for the break, and then we can restart. All right? I will give you 5 more minutes just to have something to drink, and then we can restart. Hello again, doctors. Can you hear me? Yes or no? Yeah. Okay, good. All right. All right. So, as far as I remember, we have Dr. Mustafa and Dr.
Radwa.
Zoom user. Can you remind me who is that? I can't remember. Zoom user?
Radwa.
Yes, Dr. Radu. All right. Okay, so we will take Dr. Radu and then Dr. Mustafa. After that, Dr. Peter, and then we can take Dr. Ahmed as a last one. All right. Thank you, Dr. Peter. Thank you so much. It's a bit easier for me, or not a bit. It's quite easier for me. All right. I'm doing multitask, so please just make things easy to me as well. All right. Yes, Dr. Radwa, you can read your question, please.
Okay.
It's a phone consultation, all right?
Okay.
Oh.
Begin.
Hello, I am Radwa Ahmed, one of the treating doctor at the GP. I'm speaking to Mr. Harvey Walker.
Yes, doctor.
May I confirm your first line of address, please?
It's 31 Central Gardens, P3565.
Okay, and may I confirm your date of birth?
I'm 30 years old, doctor.
And is it a convenient time to speak to you now?
Yes.
Okay, I'm calling from the GP upon your request.
Yeah.
Yeah, I can see that you are having some problem in urination.
Yes, I have burning sensation while passing urine.
Okay, can you tell me more about that since when you have this complaint?
Well, it started 1 week ago and it's still there.
Okay, and is it continuous?
Yes.
Anything make it better?
No.
Okay, and is there any specific thing happened before having this problem?
Nothing specific that I can remember.
Okay, did you did you have any fever before?
No.
Okay, any discharge?
There is some discharge
Yeah.
coming out from my penis. It's clear discharge?
Okay, and is there any rash?
No.
Any lumps?
No.
Okay, and did you have this condition before?
No, doctor.
Okay, and is there any medical condition should be aware of?
No, doctor. I'm fit and well.
Okay, and you are not taking any medications?
No.
Any allergies?
No, doctor.
Okay, so may I ask you some questions about your sexual health. Is that okay with you?
Yes, doctor.
Okay. So are you sexually active?
Yes.
Okay. And do you have a stable partner?
Well, yes, I do have a stable partner, my wife.
Okay. And no any casual partners?
I do have some casual partners, yeah, too.
Okay. And do you practice safe sex?
No,
Okay. You don't?
no.
Okay. And may I ask you about the discharge? Is it, can you describe for me the color of this discharge?
Yeah, as I mentioned, doctor, it's white.
Okay, okay, okay. And do you have any concerns at all rather than this discharge and this pain?
Nothing else.
Okay. So after the conversation I have with you, I would like to see you at the GP. Is that okay?
It's fine, yes.
We would need to do some also investigation like urine dipsticks and take a swab from this discharge.
Mm-hmm.
What do you think about that?
Okay, it's fine, doctor.
Okay. So after our conversation, I can see that what you are having might be one of the sexually transmitted disease infections.
Oh my God.
Okay. As a fact, you told me that you are not practicing safe sex.
Yeah.
It might be something related to the sexually transmitted disease.
Okay, doctor. So what will happen now?
So I can refer you
Okay, very much.
to the gum clinic.
Mm-hmm.
They will help you by doing further investigations
Mm-hmm.
and know the type of this infection
Okay.
and screen for all sexually transmitted disease.
Okay.
What do you think about this?
It's okay. Yes, doctor.
Okay. Okay. And it would be better to stop practicing sex till we have confirmation about the infection. What do you think about that?
Okay, no worries, I can.
Okay. You told me that you are married.
Yes, I do have my wife.
Okay. It would be better to take her also to the gum clinic to be screened for any sexual transmitted disease. What do you think about that?
Okay. Yeah.
Okay. You have no problem with that.
No, doctor.
Okay. And just want to advise you on practicing safe sex afterwards. That's okay.
Okay. You mean using condoms?
Yeah.
All right.
Okay. Thank you.
2 minutes remaining.
All right. So yes, thank you, Dr. Radwa.
Thank you. I still have time, but I have
It's
nothing
fine.
to say more.
No, it's fine to have time. It's not a big disaster. It's totally okay. Okay, so how do you feel first?
I think there was no need to invite him to the GP, as I will refer him to the gum clinic.
Exactly.
I know. Yeah.
Okay.
Mm.
What else?
I'm not sure. I'm so stressed.
Okay, no worries. It's fine, darling. It's fine. Did you practice before?
Yeah, I did.
All right. So you are usually practicing daily or every day or what?
Yeah, every now and then.
Okay, no worries. Did you practice sexual transmitted infections before?
To be honest, not much.
Not much. Okay. All right. So let's take it one by one. What is the
Yeah.
type of this case? it's a history-based case. The patient
Yeah.
presents with
Yeah.
symptoms, and you ask some questions, take medical history, and then you reach the diagnosis. What is your task? The task is take focused history, discuss the management, and address the patient concerns. The patient doesn't have too many concerns, to be honest. So you took focused history, and you discussed the management with the patient. You don't need to bring the patient to the GP as you
Yeah.
mentioned.
I
You
know.
send the patient to gum clinic right away. All right. What else? What is the next point? Your body language, I cannot comment on it, but I can comment on your tone of voice, which was matching the situation. You are not monotonous, to be honest. Okay. Interpersonal skills, you started a good rapport. You asked ICE ideas, concerns, and expectations. The station doesn't need any sympathy, to be honest. The patient was okay-ish, and he was not, very anxious or these
Yeah.
things. In data gathering, I would love if you ask about the urine,
Yeah.
any smell in the urine,
Yeah. Yeah.
any blood
Yeah.
coming out. All right, urinary symptoms, dysuria.
Yeah. Yeah. I have time. Yeah. Yeah.
Okay, so this is what you missed in the exploration. In the past history, you covered all. Sexual history, you covered all. Examination not needed. It's a phone consultation. For all of you doctors, please, when you ask about sexual history, try to signpost these questions. You tell the patient, well, when we have patients present with dysuria, present with lump in the groin, present with any of these symptoms, we tend to ask these patients some questions about their sexual life because it might be related.
Yeah.
Okay? Always signpost the sexual history questions.
Okay.
All right?
All right.
In the this is in the history taking. This is what you missed. In the management, you gave a diagnosis, which is a sexual transmitted infection. You could say it could be chlamydia because it's whitish. It could be something else. But they will screen you for different sexual transmitted infection to find out what is the cause exactly. All right.
Yeah.
Uh, your management was organized. You referred me to the gum clinic. The gum clinic, you can tell him there in the gum clinic, they will
Yeah.
screen you and treat you and inform your partners.
Okay.
All right?
Okay.
Then you can tell him about no sex and avoid
Safe.
unprotected sex. Okay, so this is in terms of the management. The patient was easy. He's not reluctant, nothing at all. So the case was a bit easy. All right.
Okay. Okay, doctor. Thank you.
Okay, Dr. Radwa. All right. Thank you so much.
Thank you. Thank you.
All right. If I would say something for you in your performance, just signpost the sexual history and don't miss asking about the urine in dysuria. Okay.
Okay. Thank you. Thank you,
Other
doctor.
than that, everything is okay.
Thank
All right. Dr. Mustafa, ready?
Yes, doctor, I'm ready.
All right. Read your question, please.
All right.
Begin.
Hello, I'm Mustafa, one of the doctors working in the gum clinic. Are you Helena Parker?
Yes, doctor.
Could you please confirm your age for me?
I'm 24.
All right, Helena, nice to meet you today. So I understand from my notes that you has presented to the clinic 1 week ago. Is that right?
Yes, doctor.
All right. And you are here today for a follow-up and to discuss your test result. Is that right?
Yes, doctor.
All right. So please, just to make sure that we are on the same page, can I ask you some few questions before we can discuss the test result?
Yeah, it's
All
fine.
right. So could you please tell me about your last visit? What's the symptoms that you have initially?
I didn't have any symptoms, doctor. I was just reading in the newspaper about screening of the sexual transmitted infection, and then I went there just for screening.
Yeah. And so you didn't have any kind of symptoms at all. Yeah. And so what kind of tests they offered for you?
Urine test and some blood tests.
All right. And anyone
swab as
offered
well.
you? Sorry?
And swab as well.
Yeah. And have they offered you any treatment?
They didn't offer me anything. It's just, it was just a screening.
Yes. And has anyone explained to you what might be as a result or something?
No, not yet.
All right. And so I need to ask you some few questions regarding your sexual life that might be related to that situation. Will that be okay?
Okay, doctor.
All right. So Helena, are you sexually active at the moment?
Yes.
Okay. And are you in a stable relationship?
Yes, I am married.
Mm-hmm. May I ask for how long have you been married?
For 3 years.
3 years. All right. And do you practice safe sex? I mean, you use any sexual protection?
Sometimes yes, sometimes no.
All right, that's great. And have you ever screened before for any kind of sexually transmitted infections?
No,
All right. And have you had any other partners in the last 6 months other than your regular partner by any chance?
yes, I have a new sexual relationship 2 weeks ago.
All right. And was it sexual? What is protected sexual practice?
No,
Mm-hmm. Okay. So, regarding your general health, do you have any medical conditions?
no,
Any medications regular?
no,
And are you allergic to any kind of medication or something?
no.
All right. And um, so regarding also lifestyle, do you smoke at all?
Well, yes, I smoke.
All right. And you drink alcohol?
No, just occasionally.
All right. Sorry to ask, do you use any kind of recreational drugs?
No.
All right. So now, Helena, I would like to ask you I would like to examine you. Would that be okay? I would like to check your observations.
Oh, examinations like this, observations.
All right, Helena. Thank you for answering all my questions and letting me examine you.
Okay.
So now I would like to discuss the test result with you. So so the test result shows that you have a kind of a sexually transmitted infection called gonorrhea. Have you ever heard about that before?
Oh, really, doctor? I do have one of them. Okay.
Yeah, I'm afraid to say that the blood test showed that.
Okay, and why did I get it, doctor?
Well, from what you have told me so far, actually, the gonorrhea is kind of a sexually transmitted infection. That means it might be transmitted through sexual relationship you had like 2 weeks ago.
All right. So, okay.
Right. Do you have any concerns as this point that I can answer?
Any complications from this problem, doctor?
Well, I would like to reassure you that this condition is a treatable condition. So with early detection and treatment, it's highly unlikely to cause any complications to you. Is that clear so far?
All right. So the complications are not common, right?
Yeah, that's right.
Okay.
Two
Okay,
minutes remaining.
so now I would like to tell you what we need to do.
Okay.
All right, so right now we need to start you in a treatment. We can give you a medication, actually antibiotic to treat that infection. It's called ciprofloxacillin, and it's taken orally.
All right.
Right.
For how long should I take it?
It's just single dose of medication to treat that infection.
Okay, good.
Right.
Mhm.
And also we will arrange a follow-up with you after to review your condition and also to do a test of cure that we can make sure that this infection is totally eradicated. Is that clear? Would you be able to do this?
Yeah.
All right, that's great. Do you have any questions?
No, doctor.
All right, so another thing that we need to tell you is that we need to tell other partners you had sexual relationship with in the recent period, so they can come and get tested also and treated if necessary.
All
Would you
right.
be
What
able
do
to
you
do
mean
this?
by the partner? Do you mean the new partner or my husband?
Well, actually, we need anyone that you had a sexual relationship with in the last recent period. That means your husband and the other one.
All right, no worries.
All right, that's great.
Mhm.
And also, I would like to tell you that it's highly advisable that during the period of treatment, you need to avoid having a sexual relationship until you get tested and treated completely from that infection.
Okay.
Move on
What do you
to
think
the
about that?
next station.
Yeah.
All right, great.
Right. Time's up. Thank you, Dr. Mustafa. How do you feel?
Well, I'm not sure if I can add something to the history taking part. I'm not sure if I missed something to ask about.
To be honest, you didn't miss an
Yeah.
important thing to ask, but you asked some irrelevant questions. Like at the start, you told me any treatment that they offer, any other investigations that they did. So she was just doing a screening test. So she didn't have any symptoms. So they are not going to offer her treatment unless the results are out. Okay?
Yes.
This is the first thing. Secondly, smoking and alcohol in any sexual transmitted infection, it's advisable not to ask, especially if you feel like you're going to run out of time. All right?
Mhm.
These are the things that I wanted to mention in the data gathering. Other than that, in the data gathering, you didn't miss an important thing. Even in the examination, you just need to examine, check the observations, and that's it. Right?
Begin.
Yes.
What is the type of this case? It's explaining test results. So you just need to ask about the symptoms and causes of the abnormal findings. The patient doesn't have any symptoms. What are the causes? Sexual. So the only thing that you include is sexual history, right?
Yes.
What's your task? Take a sexual history, you did, and discuss management with the patient, you did. All right. In body language, your tone of voice was matching the situation. You are not monotonous, which is really good. In interpersonal skills, you have a nice rapport with the patient. You were acknowledging. You asked me about ICE concerns. Yes, you asked me. Yeah. So interpersonal skills wise was good. We have talked about the data gathering in the management. You start the treatment with ciprofloxacin, 1 dose, and then inform the partner, no sex with protected sex. You've done almost all of the points. The only one question that or you could have answered it better is, why did I get it? Is it only from the new partner? Could it be only from the new partner? Or
No, actually, it might be from
from her husband, all right? So
yes,
then
yeah.
you are, and don't
I
tell
believe,
that.
yeah,
I will, no, don't tell that, but tell her, all right, well, because usually sexual transmitted infection are transmitted via sexual relationship, which is unprotected. Because you don't use the protection, which is the condoms, you are prone to have sexual transmitted infection. All right, that's why
yeah.
you caught this infection. It could be from the new relationship. It could be from your partner. We are not sure about this, but we will have to inform them to be treated or to be screened.
Yes.
Okay.
All right.
All right. Okay. Thank you, Dr. Mustafa.
Thank you, doctor.
Thank you. Let's do the next one with Dr. Peter. Before we start the next one, was the session helpful, doctors? Is it helpful? Until now, is it helpful? Yes, okay, good. All right. So you have more insight about sexual transmitted infections and how to deal with sexual transmitted infections. And you know that sometimes the case is easy, the patient is not reluctant. In some cases or in some occasions, you might find a reluctant patient, how to deal with them, how to deal with safeguarding issues, and how to be, friendly with children, especially children or minor people, just to avoid them to be scared from you. All right? Okay, good. That's good. I'm happy to hear that. Well, yeah. Let's do the next case with Dr. Peter. Thank you, Dr. Madiha. Thank you so much. Dr. Peter, are you ready?
Yeah, I'm here.
Dr. Mustafa, do you think that you could ask something else in this case?
Well, as I mentioned, doctor, I'm not sure if I missed anything in the data gathering part.
The patient is female.
Yes.
What else that you can ask in female patients? We have done many male patients. We didn't, ask about pregnancy, but in female, always
Yes.
about pregnancy, all right?
Okay. So
Yeah.
so how we can ask, or it is also maybe a
Can ask
routine.
any chance you
control.
might be pregnant. That's it.
Yes. Okay.
Any
All right.
chance you might be pregnant. It's not a rude question.
Yes.
For
Yes.
females, it is not a rude question. If she is if she is pregnant, are you going to give her ciprofloxacin?
Um.
I think so.
Yeah.
No.
Um. Yeah. So azithromycin is a preferred antibiotic during pregnancy, or
Yes.
yeah.
Right?
Okay. That is the only difference in management if she's pregnant.
Yes. Yes.
All right.
Okay.
Okay.
All right. Let's do the next case. Who is ready? Yes, Dr. Peter. Sorry, doctors, I am just recovering from a bad I'm not sure it's common cold or what is it, but I'm just recovering from it. So yeah. Let's do the next one with Dr. Peter. Read your question, Dr. Peter.
Begin.
Good morning. This is Dr. Peter, one of the doctors here in the AE department. Are you Miss Amila Jackson?
Yes, doctor.
Could they just call you Amila?
Yeah.
All right. Nice to meet you, Amila.
Thank you.
How can I help you today?
Doctor, I do have pain in the lower tummy here, doctor, in the right part.
Uh-huh. So there is pain in the right quadrant, lower quadrant of your tummy. Is that right?
Yes, doctor, yes.
Mm-hmm. So could you tell me on a scale from 1 to 10 how severe it is?
It's 8, doctor.
An 8. I'm so sorry to hear that. Must be painful.
Yeah.
All right. Does the pain radiate to any other part in your tummy? Does it radiate around the umbilicus, for example?
No, doctor, it's there only. It doesn't go anywhere.
Mm-hmm. All right. Does it radiate to your lower back next to your
No,
spine?
no, it doesn't go anywhere, doctor.
Mm-hmm. So when did it first start?
It started 2 hours ago.
2 hours ago. All right. What
It
about
got more. It got worse 2 hours ago, but it's there 2 days for 2 days.
it's I see. So it's getting worse.
Yeah.
Is there any blood in your urine, for example?
No, doctor.
So there is no blood, there is no pain in your back?
No,
Okay. What about your period? Is it regular? Is there any issues with your period?
no, it's regular, and the last menstrual period was 3 weeks ago.
I see. All right. So what about the genitalia? Is there any rash or anything around it?
No rash.
No rash. Is there any discharge or offensive smell?
Yes, I have greenish discharge. Yeah.
I see. So there is a greenish discharge. Is it itchy?
Um, I don't know, doctor. No, I don't have itching.
Okay. What about the discharge? Is it thick or frothy?
I think it's thick.
It's thick.
Yeah.
I see. All right. Okay. So based on your symptoms, this could be some sort of a genital infection or a sexually transmitted infection. But before we proceed, we will have to exclude some other things and do some investigations just to make sure. Because since she complained from a right lower quadrant pain, that area is most famous for appendicitis. So we'll have to exclude it. We will do a blood test. I could also book you for an ultrasonography. and then later we could do a urine analysis, probably a swab, just to make sure that everything is fine, and then we could proceed. If it is a sexually transmitted infection, I'll probably refer you to the sexual health clinic, and they will take very good care of you. Uh,
All right. So, okay, doctor. So, for now, what will happen then?
for now, we're gonna run some tests to exclude appendicitis, because if it's appendicitis, it will be an emergency, so we'll have to exclude it first, and
Okay.
then we will proceed with the sexually transmitted infection after we make sure that it's not appendicitis.
Okay. So, if it's sexual transmitted infection, what are you going to do?
I will refer you to the gum clinic. They will screen you, they will treat you, and they will take really good care of you. If it is an infection, you should also inform your partner and refrain from sexual intercourse because just to prevent its spread. Can you do that?
Yes, doctor. So, I'm not going to be treated here.
The sexual health clinic is this is their specialty, and they're much more quicker and more efficient. You know, treating you here would take time, and it's not really our job in the
Okay.
emergency department.
Is there any complication from this problem, doctor?
No, you take comfort from the fact that it's totally curable, and you know, as long as you stick to the medication and take it on time, you will be just fine, good to go. There's nothing to worry about.
Okay, doctor. So will I be able to have pregnancy in the future?
Yeah, sure. Once you get your treatment, everything will be fine. Uh, I wouldn't worry from complications at the moment. Yes, sexually transmitted infections, if they are left untreated for a while, they could cause adhesions. They may cause something that we call pelvic inflammatory disease, but that's not really something that you should worry about at the moment. Once you get screened and treated, everything will be just fine.
Thank you. Thank you, doctor.
You're most welcome, dear. Do you have any other expectations from the visit?
No, thank you, doctor.
All right, thank you.
Thank you. Okay, thank you, Dr. Peter. So, how do
2
you feel?
minutes remaining.
How do you feel?
هو انا المفروض لازم اخلص on time ولا عادي بدري؟
It's fine as long as you did everything. If you finish earlier, it's not a problem. All right? But do you think that you've covered everything in this case?
No, I'm not sure about that.
Did you're starting your preparation, right, my dear?
يعني I'm about to start.
Okay.
I
All
didn't
right.
start yet يعني.
All right. Good, 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 good. Very good. This is a very good start. Okay. So yes, keep it up. Keep it up.
Thanks.
All right. There are missed things, and this is totally normal as a start. And we are going to talk about them. All right. We will take it step by step in this case. All right. But I'm happy that you were concerned about appendicitis. I'm happy that you didn't miss that. I'm happy that you told her we will need to do an ultrasound. Okay. Could it be something in the ovaries?
That's why I asked about the menstruation. But I didn't know what else to ask for because anyway, I'm gonna do an ultrasonography to check for any cysts or any
Good.
abnormal thing on the ovaries. So I assume that this should cover it.
Yeah, ultrasound covers that. And could it be PID?
Not at this moment because she doesn't complain. We'll have to examine first, check if there's any sort of cervical excitation or any bleeding.
You
And she said,
didn't. You didn't. She has cervical excitation.
"Oh, I should ask about that."
You should. Yes.
Okay.
All right. It is PID. Okay. So yeah. So good. I'm happy that you your knowledge is very good. but
Oh, I did not examine her. I forgot the
you
examination
didn't.
completely.
Yeah, you did. You didn't do many things in the history taking and the examination. All right. But as a start, just keep it up. Okay. As a start, I'm happy with what you did. All right.
Thank you.
Okay. So let's take it step by step. What is the type of this case? It's a history-based case. Patient presents with abdominal pain. You ask some questions, you take the history, the medical history, you examine, and then you reach the diagnosis, right? What's your task? Take a focused history, perform relevant examination. You didn't do that, Dr. Peter, and discuss management with the patient. You discussed the management with the patient, but I was really concerned about the way you gave the management. You went to an you know a confirmed diagnosis that you might have sexual or a sexual transmitted infection or ultrasound, or appendicitis without even examining the patient. All right? You didn't even take sexual history. Got me?
Yeah, I forgot.
All right. So the data gathering needs more improvement. Okay? You can't go to a conclusion without uh, completing 3 complementary steps. What are they? History taking, perfect history taking, examination, and investigations. All right? You didn't take a sexual history, you didn't examine the patient, and then you went to a conclusion right away. Okay, Dr. Peter?
Yeah, sure.
Okay. Okay, so your task was, you didn't do the whole task. Okay. Body language. Well, I can't comment on your body language, but you were a reassuring doctor, to be honest, which was good. Yeah. Interpersonal skills. You built a rapport. But you didn't ask me about my concerns, right?
I asked if there is any other expectations from the visit.
Yeah, yeah. So ask her any ideas, any concerns, and then any expectations. ICE is very important in every single case in PLAB 2. All right? Ideas, concerns, and expectations. Put it as structure in your mind. After taking the history, ask ICE. All right?
All right.
This is in terms of your interpersonal skills. In terms of the data gathering, you missed many things, to be honest. All right? The patient has lower abdominal pain. You asked me, where is the pain? Does it go anywhere else? How bad is the pain? And you didn't ask, how can you describe this pain? Is it continuous? Did you take any medications for it? Any specific thing happened? So the exploration of the pain itself, you didn't explore the pain very well, and it's expected. It's expected, Dr. Peter. Don't feel any down. All right. This is a start for you, and this is a really good start. Okay. So good exploration of the pain. You didn't do that. You didn't ask about any masses. Maybe there is a mass in the lower abdomen, like abscess. Abscess can lead to, can be a complication from PID. Yeah.
Yeah.
You didn't also ask about the risk factors of PID. The patient has discharge, so this most probably PID caused by sexual transmitted infection. You can ask about previous ectopics or previous pregnancies, pregnancies outside the womb, previous infection in the pelvic area. All right. You can also ask about IUD.
Mhm.
as a risk factor. Good. You didn't ask about the sexual history. The patient presents with discharge, greenish discharge. This is most probably sexual transmitted infection. You missed asking about sexual history. All right.
Right.
So, after that, you missed examination. The examination will be like this. Temperature 38, blood pressure 110/70. So you have to give her some fluids to the patient, right? And then you send her to the gum clinic. 250 mL would be okay. Or you can just, monitor her blood pressure. It's not very bad, it's not very low, to be honest. Okay. PV, you have to do a speculum examination, which is PV examination, cervical excitation, venous discharge, abdominal examination, right iliac fossa tenderness, no rebound or guarding, and no adnexal masses. So they are telling you most probably it's not appendicitis or abscess, but you still can do ultrasound. Okay, to be a safe
Okay.
option. All right.
All right.
But they are guiding you, Dr. Peter, think about PID and as a cause of sexual transmitted infection. All right.
All right. Thank you. Thank you
you.
very much.
Thank you, Dr. Peter. All right. What is the treatment here? You give her painkiller for the pain. You do ultrasound. You refer her to gum clinic. Okay. And then you can advise her, if no improvement after the treatment, you can change the IUD. She's using IUD. Change the IUD to another contraception. Okay.
Okay.
So this is the treatment in this particular case. All right. Thank you, Dr. Peter. A good try, a very good try. Well done.
Thank you.
Thank you. I would like to do a case. We have a case, the last case with the. I will answer all of your questions, but after the last case, doctors. Who was ready? Who were the doctor for the last case?
Doctor, I would like to do the case if nobody already wrote their name.
Who is talking?
Aya.
Dr. Aya. All right. It's fine. You can just check with Dr. Ahmed if he's happy to do the case because
Yeah,
we.
no worries, doctor. I already did two cases, so yeah, she can do it.
All
I have no
right.
problem with
Thank
that.
you. So kind of you, Dr. Ahmed. All right.
No
Good.
worries.
Dr. Ahmed, I'm sorry, I didn't know that you wrote their name.
It's
Just
not.
No
It's
worries,
fine.
no worries.
sorry.
I already did
Totally
a
fine.
case, so no worries. You can do
All
it.
right.
Okay, thank you so much.
Okay.
No
Okay,
worries.
Dr. Aya. Let's do the case, Dr. Aya.
Yeah, sure, doctor.
All right. Start the timer. Read the question, please.
Begin.
Hello, I'm Aya. I'm one of the doctors here. Am I talking to Mr. Ernie Fox?
Yes, doctor.
Hello, Ernie. It's lovely meeting you today.
Thank you.
Could you please confirm your age for me?
It's 35, doctor.
Okay, so Ernie, I understand from my notes that you have some knee pain, right?
Yes.
Could you please tell me more about that?
Well, I do have this pain for 1 week now in both knees, and it's getting worse. That's why I came here.
Oh, I'm very sorry to hear about that. So Ernie, is this the first time you experience this kind of pain?
Yes.
And anything in particular happened before you experienced this pain? Any trigger, like any trauma or anything at all?
No trauma at all, doctor.
Okay. And you mentioned this is in both of your knees, right?
Yes.
And could you describe the pain for me?
It's something like aching, doctor.
Okay, and like a scale from 1 to 10, how would you grade the pain?
It's 5.
Okay, and did it start all of the sudden or like in a gradual manner?
No, gradually.
And anything making the pain better or worse?
Nothing specific.
Okay, and along with the pain, is there any swelling?
Any?
Swelling.
Swelling. Yes, I can see that the knees are swollen a bit. Yeah.
Okay, any hotness on or redness?
No,
Okay, and have you been feverish?
no fever.
Okay, and okay, have you had any like flu-like symptoms recently?
No,
Okay, and does this pain like in a continuous manner or does it come and go?
it's continuous.
Okay, and do you have any other symptoms, Ernie?
Symptoms like what, doctor?
Is it affecting your walking or like your daily activities?
Yes, I can't walk properly. It's painful, doctor. Yeah.
Okay, I'm very sorry to hear that. And Ernie, do you have like any stiffness in the joints as well?
No,
Um, any problem with any other joints, like in your hands, your feet?
no,
Have you noticed any change in your weight recently?
no,
Any rash on your face recently?
no,
And have you experienced any ulcers in your mouth or in your private area?
no ulcers. No, no,
Any lumps or bumps anywhere in your body?
no,
Okay, and okay, so Ernie, have you traveled anywhere recently?
no.
And do you have any other medical condition?
No, doctor. I've done well.
And do you take any kind of medications, including like over-the-counter medications?
No,
Any allergies?
no,
Okay, and do you smoke?
no,
Do you drink alcohol?
no.
Okay, okay, so Ernie, um, any idea what may be causing this knee pain? Knee pain?
No, doctor.
Anything in particular you're concerned about?
I just need any treatment for it. I tried paracetamol, but it doesn't help at all.
Okay, I'm sorry to hear that. Okay, so Ernie, I'd like to ask you a few personal questions regarding your sexual life, if that's okay with you.
Is it important, doctor?
Well, it's a routine in consultations like that, if it's fine by you.
All right.
So Ernie, are you sexually active?
Yes.
And are you in a stable relationship?
Yes.
Okay, and do you practice safe sex?
No, I don't like using condoms.
Okay, and any other casual sexual partners?
It only happened once, doctor.
Okay, and were you using condoms then, or?
No,
Okay, no worries. And okay, could you tell me, have you ever been tested for sexually transmitted illnesses?
no,
Okay, and have you been experiencing any problem with urination lately?
no.
Any discharge from your penis?
Yes, I do have discharge, greenish discharge.
Okay, tell me more about it.
It started 1 week ago.
Okay,
Yeah,
and you mentioned it's greenish in color.
yes.
Okay, does it have a distinctive smell?
It's no, it's just bad smell.
Okay. Okay, so any one of your sexual partners have a similar discharge?
No,
Okay. Okay, so Ernie, thank you for answering all my questions. I just need to examine you now, if this
2
okay with
minutes
you.
remaining.
Okay, what are you going to examine?
So I need to take your vitals, examine your knees, and examine your private part. I'll be having a chaperone with me, and then maintain your privacy. Okay, so thank you for letting me examine you, Ernie. Well, Ernie, it seems like I'm suspecting that you have a sexually transmitted illness that has been affecting your knees as well. How do you feel about that?
Okay, doctor. So what's the relation between
Well, okay. So Ernie, I'm suspecting that sometimes the sexually transmitted illness can, affect other body parts like the joints, the eye, heart, and brain. So I just need to refer you to the gum clinic to be tested for different sexually transmitted illnesses to confirm the diagnosis and start your treatment.
Okay.
So do you think you can do that?
Yeah.
Okay, so Ernie, it's also important to tell your contacts, anyone you had sexual intercourse with, also to be tested in order to receive treatment as well.
Should I tell my partner, my wife, doctor?
Yes, you should.
No, doctor, I don't want to tell her.
May I know why?
It's a disaster, doctor. She will know that I cheated on her.
Well, I know you are in a tough situation, Ernie. I'm very sorry about that. But it's important to tell her in order to be tested and to be treated because, she may have contact the infection from you and it will affect her as well because, as I told you, this kind of infection can have complications. So
Move on to the next station.
I'm very sorry, doctor. I got lost at the beginning. I was struck by the knee pain and I just kept going in circles.
It's fine. It's fine, Dr. Aya. All right. So how do you feel?
Yeah, I feel bad because my exams, it's near. It's not that far away. So
when is your exam?
May 28th.
You still have time. No, don't worry. Yeah, so okay. All right. Don't be scared. All right. Sometimes, the cases are just difficult or the simulator is difficult. And that's why we try to, do some variations in the cases. Okay?
Okay.
All right. So let's take it one by one. What is the type of this case?
History taking.
History taking. The patient presents with knee pain. You ask the questions to reach the diagnosis. All right. Knee pain can be what?
Can be a lot of things. Can be septic arthritis. Can be reactive.
So the first thing in your mind that you have to exclude in any joint pain is septic arthritis. Okay?
Begin.
This is the first thing. You asked me about fever and hotness and redness, which was good. All right. Could be what else? Trauma, right?
Right.
Could be rheumatoid arthritis, could be any inflammatory condition, could be reactive arthritis. And this is the case.
Okay.
Reactive arthritis. So always put in mind any joint pain, could be septic, could be inflammatory. I mean, reactive is an inflammatory, but could be, autoimmune problem, inflammatory problem, or reactive arthritis. Okay? So
Okay.
in any joint pain like this, always bear in mind after excluding septic arthritis and stiffness and weakness and the immunological conditions, ask about discharge, urine, eye problems, and sexual. All right?
Okay.
Okay. So urine problem, you've asked me about this. Eye condition or eye problem, and sexual history. Okay?
Okay.
You're a bit, you know,
Disorganized.
hesitant or disorganized, or you got lost at the first. I'm not sure why. After taking the present history, I felt that you were just, you know, going through the history taking just for searching what will
I was
be
buying
the
myself
answer.
time just to know what to ask next.
Yeah. Why did you ask about travel?
So I thought maybe he had like a unprotected sex on travel. I felt like he was hesitant, so I didn't want to ask like sexual history right away. I just thought maybe I'll
Well,
ask about the travel history first.
no. Well, it's not advisable. Just go to the sexual and tell him, well, okay, when people come to us with knee pain, we tend to ask some questions about the sexual history because it might be related to the symptom. All right? So this is
Okay.
how to signpost sexual history. Okay?
Okay.
Um, all right. So I'm happy that you've done this mistake or you were a bit lost. Just for all of you doctors to take care if a patient presents with knee pain or any joint pain, just the first thing in your mind to exclude is the septic arthritis and then immunological conditions. And after that, don't miss Reiter's disease or Reiter syndrome or reactive arthritis. Okay? And reactive arthritis can be triggered by a common cold, okay, an infection before, any infection, diarrhea or urinary tract infection, any infection before the onset of the pain, or sexual transmitted infection. Okay, doctors?
Okay.
All right, so you have two problems in this case, the reactive arthritis and the STI, right? So you try to deal with both of them in your management. Okay? And I'm going to tell you how to deal with them. Okay? So this is in terms of the type of the case, what is the data gathering, what you missed, and what you should do. All right? In terms of the body language, I cannot comment on the body language, but I can comment on your way in dealing with the patient. I felt that you are telling me facts. I mean, I told you, is it important? You told me, yes, you have to. I feel like you are, you know, giving me facts. It is what it is, and you have to do that. All right. You have to be more, you know, interactive with the patient. Tell him yes, and you know, with a good facial expression and you know a friendly way. All right. Do I have to tell my partner? Tell him yes. I'm afraid. It's important to tell your partner. Okay. So always use the phrases that show high interpersonal skills. Okay, Dr. Aya?
Yeah, sure, doctor. Thank you.
All right. So this is in terms of interpersonal skills. In terms of your management, you tell him, well, Mr. X, you have this knee pain. All right. This could be something related or something called reactive arthritis. Okay, it's an inflammation of the knees in reaction to an infection in the body. And most probably the infection that you have is a sexual transmitted infection. You told me that you had unprotected sex. So this is most probably, and a discharge as well. All of these are suggestive of sexual transmitted infection. Okay, Mr. X, would you like to know what is the treatment for your knees we will start you on non-steroidal anti-inflammatory drugs to ease that pain. We also might need to start you on steroids for treatment of the inflammation as well. Okay. For the sexual transmitted infection, it's highly important to send you to the gum clinic to be screened there for the sexual and transmitted infections and to be treated for this infection. Okay, it's highly advisable if you just avoid unsafe sex and use condoms afterwards. All right. Okay, Dr. Aya. So you just put the management into in two ways. The first way, which is the arthritis. Okay. The second one is the sexual transmitted infection. Okay, doctors?
Okay, thank you, Dr. Sahab.
Thank you, Dr. A. All right. So this is how to be organized. I think we have done all of the cases today. I just want to give you 5 more minutes or 10 more minutes for your questions. Before I answer your questions, just to reiterate the management of the last 2 cases, the PID one, just for all of you. The PID one, the management in the particular case that we have discussed, pain in the right lower quadrant with cervical excitation and greenish discharge. All right. You do ultrasound to the patient, give the patient painkiller. All right. And then you discharge the patient to the gum clinic. In the gum clinic, they will screen her and notify the partner. Screen and treat her and notify the partners. Okay? In terms of what she can do to avoid unprotected sex, use or practice safe sex afterwards and take the medications. Okay? This is the treatment of PID case. In the case of arthritis, you treat the arthritis and you deal with the STI. In arthritis, you give symptomatic treatment, which is the painkiller, okay, non-steroidal anti-inflammatory, and you can start the patient on steroids for the inflammation, okay, and follow the patient up. In terms of the sexual transmitted infections, you refer the patient to gum clinic for screening and treatment and notify the partners. Advise the patient for protected sex and avoid unprotected sex. Okay? All right. While I'm answering your questions, I will share a poll with you. Okay? Just write down your comments on the session and your suggestions as well for the upcoming sessions. Let's see the questions. Who is doctor? Who is the name doctor? In the PID case, she is in A&E and in pain. Couldn't we take the swabs and start the treatment in there and then ask her to go gum clinic? And if we did that, would that give us low marks in the exam or fail us? Other question, please. What are the criteria to treat her in hospital? Thank you very much in advance. All right. Okay, for the first question, taking a swab and starting the treatment. It's better to be in gum clinic for the sexual transmitted infection. Okay? It's better to be in the gum clinic. All right? You keep her in the hospital for the ultrasound, and if she's not stabilized, if her vitals are not stabilized, okay? Like what? Very low blood pressure, high respiratory rate, oxygen saturation is low, signs of sepsis. If the patient is showing these signs, you have to keep the patient in the hospital and treat her in the hospital. Okay? But if the patient is stabilized and she's okay, she can go to the gum clinic. You just check that this is not another cause of the pain, and then you refer the patient to gum clinic for treatment. All right? Did I answer your question? Doctor. Reactive arthritis can't see, can't be, and can't climb the tree. Yes, this is what I teach people. Yes, can't see, can't be, can't climb the tree. Can't see, eye affection, can't be urinary symptoms, and can't climb the tree, pain in the joints. Do we need to refer the patient to the rheumatologist in reactive arthritis? You refer him if no improvement. If no improvement. Okay. All right. Are these only the questions? Let's see if there is any question. Can we differentiate from just the history about the cause of knee pain, septic or immunological or reactive? From the history. Well, usually you do the complementary, the three complementary categories: history taking, investigations, and examination. Okay? In the history taking, if the patient has fever with severe pain and swelling, in addition to hotness and redness in the knee, you have to admit the patient for treatment of septic arthritis. Okay? The patient doesn't have hotness or swelling or fever, no signs of infection. You can just order X-ray and take an advice from the orthopedic team. If you would like to be more safe or safer, the safest doctor in the world, you tell the patient, well, I'm going to take an advice from the orthopedic team. This is if you are in the hospital. Yes. In the GP, you can call one of the orthopedic team, or you can send the patient to the orthopedic team in the hospital if you feel that this is most probably septic arthritis or might be septic arthritis. Okay? In the case that we have done, the patient doesn't have fever, doesn't have severe inflammation. The joint is not swollen or hot. Sorry, not hot or red. Okay. The patient is stabilized. If you say reactive arthritis and you treat like this, it's okay. If you want to be safer, you can tell him we will need to exclude also one of the severe, the serious infections, which is septic arthritis. We can send you to the hospital. It would not be a problem. All right. Okay. Any other question? Any other question? Differential diagnosis in the knee pain. Firstly, you have to or any joint pain, not only knee pain, any joint pain. Septic arthritis, immunological conditions, reactive arthritis. These are the most common differentials that you have to think about in any joint pain. And please don't miss trauma, especially if it's acute, not acute, sudden, all right, trauma before the onset of pain. All right. Okay. So I think I've answered the questions. Thank you so much, doctors, for attending and listening as well and participating. I hope it was helpful and useful. And now you have more insight or huge insight on sexual transmitted infection, how to deal with them. And I hope I cleared all of the confusions regarding the sexual transmitted infections. Did I do that, or you still have confusions? Just write yes or no, or if you have question, please write it down. Dr. A is saying yes, thank you. And the other people, other doctors? Dr. Soa is saying yes. Doctor saying yes. Good. One more. Two more. I need two more. Okay, good. More than five, then yeah, 6, 7. Yeah, 7 yeses. Happy. 8 yeses. Okay, good. Good. All right. So, inshallah, the next session will be the week after the next week. All right. And I think we are going to discuss abuse. This is based on the poll that we have shared. I have shared the poll on the Telegram, and the votes were for counseling, then STI, then abuse. All right. So the next session will be abuse, inshallah. All right. Yeah. Thank you so much, doctors, and see you, inshallah, in the next session.